I am Dr. Mohammed Khan. I'm an internist practitioner associated with Ohio Medical Group. I'm going to talk about a common disease known as diabetes mellitus. This is more and more common as people are appreciating and coming to physicians for its diagnosis and management. The main symptoms that you should look for is that you are hungry, eating too much, drinking water too much, and passing water too much. You may be sometimes losing weight. Sometimes people who are overweight tend to become diabetic because of the certain ways the body acts and cannot work. And therefore, always healthy style as far as the weight and the diet and exercise is concerned is desirable, not only for the purpose of treatment and improvement in the quality of life, but also prevention of various diseases, including the diabetes. Diabetes mellitus is a disease where the sugar is not controlled by internal metabolic mechanism of the body, relative deficiency of the insulin, or absolute deficiency of the insulin. There may be sometimes a resistance to insulin, especially in the obese people, which affects almost all parts of the body, and namely these people are at risk of heart disease, they are at risk of kidney disease, they are at risk for blindness, stroke, to name the few. There are two types of the diabetes. There is one group which is usually in a younger age group, less than 40 years old, which usually is insulin deficiency of significant nature, and that needs insulin replacement therapy. And they may present with acute or subacute illness, including unconsciousness or being sick, that may become worse in times of the stress, pregnancy, infection of any sort like pneumonia or other conditions. There may be one variety of diabetes in a younger age group, which is also known as maturity onset diabetes of the young, which happens when the younger age obese persons develops insulin resistance and sugar goes up. Maturity onset diabetes of the young is like type 2 diabetes, and type 2 diabetes usually occurs in the people above the age of 50. The best course of action in a normal people that they should visit to the doctors as appropriately suggested, at least annually, and have things checked up. The blood sugar testing is the best mode of knowing the level of the glucose and thereby making a diagnosis of diabetes. As far as the treatment is concerned, the main focus is the diet and exercise. Nevertheless, there are pills to help out, and insulin shots are available to suit particular person's daily activity of life and his or her circumstances. I would suggest strongly, for any questions in relation to the diagnosis or management, you should contact your own physician, or if you choose Ohio Medical Group physicians, they will be happy to answer all your questions and concerns.